So just want to welcome everyone to this legislative debrief for the Children's Advocacy Alliance. I hope you all survived the legislative session and have found some time to relax and recharge. It's been pretty much a month since the session signee died, which doesn't seem possible, but hopefully it's been restful for everyone. My name is Elisa Caffaretta. I am the new executive director of the Children's Advocacy Alliance and super excited. This is my seventh day, so just jumping in with both feet. I know a lot of you from my lobbyist days with Planned Parenthood or the Progressive Lobby Corps. And if I don't know you from that, I might know you from when I was the deputy administrator at the Division of Welfare, where I had child care and child support in my portfolio, or maybe from my days at Dieter when I had unemployment, workforce development, and vocational rehabilitation in my portfolio. Since then, there I am. I've been doing futures thinking and change management consulting. But when I saw this opportunity to get back into the advocacy world, I was thrilled to take them up on it. So excited to be here. I think all of you know about the children's advocacy. Oh, I'd asked you to sign into the chat and it's not working. All right, well, we'll get there. Um, I think all of you know about Children's Advocacy Alliance. It's an independent voice for Nevada's children. We're funded by foundation grants and individual contributions. So we've been able to avoid some of the funding turbulence from the federal level, but we certainly are aware of it and its impact on our partner organizations and the children of Nevada. We're working to ensure that every child in Nevada has the opportunity to thrive, and we do that by building consensus around policy priorities and leveraging the strength of our collective voice to create lasting change, which you have all been a part of it. I know many of you were in the fight with us at the legislature in one way or another, but I think you'll be impressed, as I was, as we take a look at how CAA, our staff, and our partners, supported by you, came together for some very important wins in a challenging session for Nevada children and families. So I am going to turn it over to Dr. Tara Rains, policy strategist, advocate, professor, who cares deeply, as you all know, about making systems work better for children and families. She's been leading the charge on moving good ideas into policy, and she's also our deputy director. So, Dr. Rains.
Thank you, Elisa. I appreciate that. Good afternoon. Again, I'm Tara Rains, Deputy Director here at the Children's Advocacy Alliance. And it is an honor to be able to meet with you this afternoon and chat a little bit about our legislative session and some of our wins. Just as a refresher, Children's Advocacy Alliance, we operate right now on our three primary pillars, and that's health, which includes physical and mental health, child welfare and safety, and early childhood education, which includes that prenatal to around age 8 age. And so with these priorities and our coalitions that many of you are a part of that we built based on these priorities, we came up with a number of bills this session that you helped us move through the legislative body. And I just want to take a few minutes to say thank you and give gratitude to all of you for being part of our coalitions and talk a little bit about what is advocacy and why you are all advocates. And so I hope that you're holding on to that title as an advocate. Advocacy is that support for or recommendations of any particular cause or policy, and that is what you all have done this session. And why do we do the advocacy work that we do? We see now more than ever a context where money is leading decisions, right? And we want to make sure that folks who don't have the resources, like children in particular. They can't vote, they can't write contributions and give contributions and donations. And so they need a voice. And so we are here collectively to be that voice and make sure that we can move toward positive systems change. And as our CAA vision is a Nevada where every child is able to thrive. And so we couldn't have done it without you, of course. And so thank you for engaging. We called you during the interim and you showed up. We called you during the session and you showed up. You wrote letters, your friends wrote letters, your neighbors wrote letters. You called in, you gave testimony. We worked together on testimony with many of you, and so we're grateful for you. And I'd like to, before we transition into the full debrief of our session, I want to take off. I'm going to give it over to Caleb Cage, who was our lobbyist this session. To Caleb, talk a little bit about your perspective as a lobbyist for child and family issues.
Thank you very much, Tara, Dr. Rains, and welcome, Elisa. It's good to see you again, and it's good to see all the members of the CEAA team here. I'll just be brief in my remarks. I know you have a lot of important perspectives to get to, but I just want to say a couple of things. First, it was a true honor and a privilege to work with the CAA team. It was Carissa, who I got to work so closely with during session, is an amazing asset and resource for your organization, and just did a fantastic job, not just advocating, but also educating and helping me to understand the breadth of issues that you were advocating for. It was, from my perspective, not just an honor, but a real pleasure to work with CAA towards your policy goals. And that came from a number of sources. One, because the policy objectives and initiatives that you were pursuing, that we were pursuing, were so important, are so important, and often are left without an advocate. And so being there at the table or being there in the room or negotiating over amendments on things that were so important was just really inspiring and really exciting for me. Second, I just want to say, I think for a coalition, it's always difficult to align around priorities, especially when you get to the amendment negotiating process, because some groups may want to prioritize certain things and deprioritize other things, and vice versa. However, working with CAA during this legislative session, I was really impressed and inspired by the coalition's teamwork and willingness to work together towards the goals and issues that you had clearly worked so hard on pursuing during the interim. So I'm going to leave it there, but I just want to say thank you for the opportunity to represent you. Thank you for the opportunity to work with all of you, and thank you for the great work that you do for Nevada's children. So thank you very much, Dr. Rains.
Thank you, Caleb, and we appreciate you and could not have seen the wins that we saw without your brilliant strategy and support. So thank you for everything. I am now going to turn it over to Carissa Pierce, who is our Government Affairs Manager and Health Policy Analyst, to share more specifically about some of our wins.
Thank you, Dr. Rains. Okay, hi everyone. It's so awesome to see you all here. My name is Carissa Pierce, and I am our Government Affairs Manager and also working within health policy. So I'm going to go over specifically CAA's health priorities from the 83rd legislative session. All of these were developed through the Children's Mental Health Action Coalition during the 2024 interim period. So many of you here were also a part of that coalition or a part of one of our other coalitions. And these are the three bills that we presented on to move the needle forward for children's mental health. Senate Bill 165, Assembly Bill 339, and Assembly Bill 340. Starting off with Senate Bill 165, we are thrilled to tell you that it passed through the legislature and was signed by the governor. So SB 165 was sponsored by Senator Wynn, and it expands Nevada's child-focused mental health workforce through higher education. The passage of SB 165 does a few different things. It creates the Behavioral Health and Wellness Practitioner License. It seeds the first ever accredited psychology internship program in Nevada. That'll be at UNLV. And it establishes bachelor's and micro-credentialed programs focused on prevention-based care for children at UNLV, UNR, and Great Basin College. And it provides scholarship funding for students who join the newly developed programs once they're up and ready. On this initiative, we worked collaboratively with the University of Nevada, Las Vegas, University of Nevada, Reno, and Great Basin College throughout the interim and the legislative session. And with the passage, they are already ready to begin the creation of the bachelor's and micro-credential programs. So we're really excited to see the implementation moving forward. One unique aspect about the program is that they offer a combination of coursework and clinical experience before the student graduates. This allows for students to meaningfully prepare for a career in child behavioral health and gain some realistic experience. Finally, for Senate Bill 165, I want to give a shout out to the Oregon Balmer Institute for Children's Behavioral Health. They uplifted a similar program in Oregon a few years ago and have supported SB 165 throughout its development and its journey through the session. So that looked like people from Balmer Institute providing testimony and being available during the bill presentations to answer questions. And they were asked questions that really helped our legislators get a scope of what this provider will look like and brought real world context to our bill proposal, which was really, I think that was a huge success for this bill. Moving on, Assembly Bill 339 was sponsored by the Health and Human Services Committee and presented by Assemblymember Golding. This bill would have established the Office of Children's Mental and Behavioral Health with the purpose of providing statewide leadership for children's mental health. So Governor Lombardo proposed a health bill, or in his health bill, also introduced an Office of Mental Health. And what was exciting for us was the language for 339, Assembly Bill 339, was amended into the governor's bill to become the framework for the Office of Mental Health. Unfortunately, the governor's health bill did not pass through the session and died with the closing of sine die. So we were disappointed to see that outcome, but I do think that we were very successful this session in educating state leaders of the need for statewide coordination for children's mental health. And I think we all are anticipating seeing this initiative gain more awareness and support as we move forward in this interim and coming up into our next session. Finally, the last bill that I am highlighting is Assembly Bill 340, which was also sponsored by the Health and Human Services Committee and was presented by Assemblymember Orentlicker. This bill would have mandated insurance coverage for the screenings, assessments, and diagnosis of developmental delays of childhood to align us with existing best practices for autism spectrum disorders. So essentially, this came because we know that diagnosis is essential for early intervention, and early intervention can dramatically improve a child's development and their ability to learn, and it lowers the likelihood that they will need additional services later in life. So although this bill did not make it through this legislative session, our focus remains on improving access to services for children and families in need and supporting our pediatricians and providers in Nevada. So thank you for the opportunity to share our CAA health priorities. We also testified on dozens of bills that positively impact families, and we are going to continue to uplift child and maternal health in Nevada. So I would now like to introduce my colleague, Annette Dawson-Owens, who will talk to us about child welfare.
Thank you so much, Carissa. And here's the child welfare priorities that we will talk about. Substantial progress in Nevada's child welfare landscape was made during this 2025 legislative session. Wins such as better financial protection for foster youth, response by child protection workers, reinforced early family health services, and expanded in-school support reflect the ongoing desire and commitment of our community and Nevada legislators to continue working towards improving the safety, stability, and well-being for children and families statewide. So we will highlight a few of these bills. Senate Bill 284 was sponsored by Majority Leader Nicole Cannizzaro and in essence ensures children in the foster care system are proactively enrolled in eligible federal programs and that the benefits are securely managed and their financial interests are safeguarded. This primarily focuses on Social Security benefits, and we have a guest speaker, the amazing Jonathan Norman, who worked closely on this initiative and who will share more in just a few minutes. CAA supported additional initiatives that are listed here to child welfare, including SB 183 and SB 306. SB 183 was sponsored by Senator Melanie Scheibel and imposes a statutory cap on the caseloads in Nevada's child welfare system, limiting each caseworker to no more than 30 children on their caseload. The bill includes important exceptions to allow for siblings to remain together and to permit temporary caseload surges in emergencies up to 30 days. The measure aims to reduce overwhelm among our caseworkers, enhancing monitoring and support, and ultimately to improve the permanency outcomes for children. CAA was able to provide additional feedback and guidance to foster parents who brought the idea to Senator Scheibel. SB 306 was introduced by Senator Michelle Cruz Crawford and Assemblymember Erica Mosca, aimed to strengthen Nevada's child mental health infrastructure and protect child welfare professionals. The bill proposed the creation of a multi-agency task force to design transitional housing and support services for children when they're discharged from psychiatric facilities or released on parole. It was commonly referred to the No Eject, No Reject bill, and it would have required inpatient facilities to admit Medicaid-eligible children unless at full capacity. This would have supported the Southern Nevada Child Haven facility, which is over capacity for inpatient care. It also would have mandated formal discharge planning with guardians and updated facility designations to better serve our youth with emotional disturbances. Additionally, SB 306 expanded the legal definition of officer to include child welfare workers, granting them enhanced protection under the assault laws. Although the bill passed both chambers with strong bipartisan support, it ultimately failed to advance before the close of the 2025 legislative session. Despite this, SB 306 laid critical groundwork for future reforms to improve access, safety, and coordinated care for vulnerable children in Nevada. We also want to talk for a minute about SB 460. We are excited about Nevada's Senate Bill 460, often called the Major Education Reform Bill or an accountability and oversight overhaul for Nevada schools. This legislation merges initiatives from Senate Majority Leader Nicole Cannizzaro and Governor Joe Lombardo. It provides for open zoning and transportation as funds are available and seeks to strengthen accountability and expand early childhood education across the state. It includes an estimated $50 million appropriation, again subject to funding availability, for grants to expand pre-kindergarten capacity and funding especially for early childhood education facilities and early childhood literacy and readiness programs. Although once again, actual implementation depends on the available resources. While universal pre-K funding isn't guaranteed, the bill extends eligibility for state-funded pre-K beyond 4-year-olds and raises the household income threshold up to 250% of the federal poverty level, aiming to serve more low and middle-income families. I will now introduce my coworker, Dr. Nance, who she and I share some of these early child priorities, as she serves as the Early Childhood Policy Director for CAA, where she leads our organization's Strong Start Prenatal to 3 initiatives. With deep experience in early education and systems-level advocacy, she has been a visible voice at the Nevada Legislative and Advisory Committee hearings, consistently underscoring the critical need to expand access to high-quality childcare, secure stable housing, and align governance structures to support holistic early childhood systems.
Thank you, Annette. Wow, I am so deeply proud of the progress that we made this legislative session, especially in our advancement of early childhood policy. Together, we broadened awareness and understanding of critical early childhood issues. We elevated the voices of those most impacted, and we collaborated across party lines to keep children and families at the center of our legislative efforts. Now, while this session did not yield the policy wins that we hoped for, it unquestionably laid important groundwork. The seeds were indeed planted, and we are confident that our efforts will lead to meaningful, lasting change. In this reflection, I'd like to just highlight some key early childhood bills that CAA championed, and share some insights that will guide our path forward as we build on the lessons learned this session. So I'll start with Senate Bill 82, and that bill would have established the Office of Early Childhood Systems within the governor's office. The appointed director of this particular office would have provided an overview of Nevada's programs that support young children and families with the goal of reducing redundancy, strengthening the delivery of services, and really streamlining the current funding and identifying sustainable funding opportunities, so crucial for our current early childhood system. The bill originated in the interim Joint Education Committee and landed in the Senate Government Affairs Committee. And so we would like to thank our potential presenter, Senator Angie Taylor, for agreeing to bring that bill forward. However, it did not make it past the first committee deadline, which was April 12th. Some of the implications behind this particular bill is that we know that establishing a dedicated Office of Early Childhood System would have centralized state leadership, unified funding strategies, and created a data-informed approach to early childhood policy. The office would have set the stage for a sustainable, coordinated, and comprehensive early childhood system while minimizing bureaucracy. And so it goes without saying that this one is really important to us, and we are looking forward to ways to move forward in identifying how to ensure that we have a coordinated early childhood system here in Nevada. I'll now turn our attention to Assembly Bill 185. And this particular bill would have expanded access to licensed home-based childcare in common interest communities with homeowners associations. Through Assembly Bill 185, HOAs would be prohibited from denying a childcare provider the right to become licensed for home-based childcare as long as they have met the requirements for licensure. This bill was sponsored by Assemblymember Natha Anderson. This bill was introduced February 3rd at the opening of the session, and it passed through the legislature on May 27th. However, unfortunately, this bill was vetoed by the governor on June 5th. So some of the things that we know about the importance of AB 185 is that it would have allowed for home-based childcare providers to become licensed regardless of whether they lived in an HOA. Decreasing those barriers for licensure would mean increasing the ability to serve more of Nevada's families, and the cost of care would decline, as we know that home-based care is oftentimes more affordable. It would offer families more options for care that best meet their families' needs. And so now, finally, I will turn our attention to Assembly Bill 388. This was a bill that CAA supported that was brought up or sponsored by Assemblymember LaRue Hatch. This bill requires employers with 50 or more employees to implement a paid family and medical leave program. Like AB 185, unfortunately, AB 388 progressed through the legislative process and was vetoed by the governor. We know that this particular bill is important for the financial stability of Nevada families as it promotes social, emotional, and economic well-being of children and families by allowing caregivers the time they need to bond with their newborn or provide critical care to their loved ones. And so as we consider where we landed this session, it is often said that the legislative process is a marathon. And we at CAA will continue to run this race to implement policies that produce the best outcomes for Nevada's youngest and most vulnerable populations. So what does that look like? I will now turn it over to Carissa to share with you a little bit about our interim timeline to consider as we begin to strategize on where we want to pick up where we left off this session and move forward together. So Carissa, I'll turn it over to you.
Thank you, Jamel. Hi again, everybody. Okay, so I want to just preface the majority of this timeline is focusing on the legislative timeline through the interim. But we did want to mention that throughout the interim, CAA is going to continue hosting coalition and partner meetings as we continue to reflect on our bill strategies for 2025 and begin to develop our legislative agenda for the 2027 legislative session. So this timeline provides a broad overview of the different periods of the interim, and it is still being drafted to be more specific for the next year and a half. But we did want to get our minds started on what does this interim look like and how can we really leverage it to be prepared for the session in 2027. So let's get into it. Right now, we are on the very left of this timeline. Nevada's 83rd legislative session ended on June 2nd, which marked the start of the interim session on June 3rd of 2025. So we are just shy of a month from that time, which is crazy to think that it ended a month ago already. So some key legislative events to be aware of include that the interim committee hearings will be taking place from January to July in 2026. These hearings are a good opportunity to learn what various committees are focusing on, and they are a good way to stay involved with the legislative process. Next, we are going into an election year, and the state candidacy declarations will take place in March. So this is a great time to participate in get out the vote efforts and encourage Nevadans to register to vote for some of those reasons about why we do advocacy and why it's important for us to encourage parent, family, community voice. Between March and August of 2026, the state agency budgets are being developed and delivered to the governor, which then supports the governor's development of the state budget that will be shared prior to the 2027 legislative session. And then we're at the start of the 2027 legislative session again on February 1st of 2027. So we are going to be developing more specific timelines for each of our coalitions to follow throughout the interim. And if you're curious what that will look like, please consider joining us in one of our coalitions. We would love to have you there to uplift your voice and to be a part of those conversations. If you are interested, absolutely reach out to any of us or get involved on our website. And I'm now going to turn it back over to Elisa to highlight some of our key partners who have been instrumental in championing CAA's policy priorities.
Thanks, Carissa. What we've done is we've asked our partners to give us their thoughts on the experience of the session and what they're focusing on next. So they might mention specific bills because there were a lot more than those we highlighted here, but really the questions we asked them to share with you, so you have some more insights into, you know, what we learned and accomplished and how we're moving forward after the session is what lessons did you learn while advocating during this past legislative session? What are your priorities going to be during the interim? And we understand this is the first draft view, not a final version. And what do you see as the most important issues to advance for children and families in Nevada? So we're going to start with Lee McAllister. She is the Pediatric Population Health Manager for Intermountain Health in Nevada, and also is very active with the Nevada chapter of the American Academy of Pediatrics. She's been a longtime advocate for children and pediatricians. So we'll turn it over to Lee.
Thank you so much for having me here today. This was my third legislative session in Nevada, although I did a lot of advocacy work with Boston Children's Hospital in my home state of Massachusetts before moving to Las Vegas in early 2018. Yes, my day job is in population health for Intermountain Children's Health, but today I am here just representing the Nevada chapter of the American Academy of Pediatrics. The AAP is a 95-year-old professional association for pediatricians born out of advocacy, and really one of the most important things that the Academy does at the national level and at the state level. My lessons learned this session is actually a lesson that I have to keep relearning, but it amazes me every time, and it's the power of one person's story. So during the 2023 legislation session, I was at Children's Week with Children's Advocacy Alliance, and this lovely couple came up to me, AJ and Krissa Markov, And they shared with me the story of their son, Bennett, and the unexpected, very painful bill that they ended up with after the passing of Bennett. They shared that story with me and any other advocate that they could find at Children's Week and any legislator that they could find. And that story grew. It spread through me to pediatricians. It spread through all the people that they touched, so that just in one session, 2 years later, SB 138, which came to be known as Bo's Bill, was able to be passed and signed by the governor. And it was named for another child who survived, but also whose family got caught unexpected with a very large bill. I won't give you all the details of the bill, but essentially it's about presumptive eligibility for Medicaid, because these families would qualify for Medicaid coverage for their children, but because of not getting paperwork in on time, that was the problem in legislation that we had to solve, because no family should be asked to have to pay attention to paperwork and red tape when their child is critically ill. So that was my lesson learned. My interim priorities is vaccines, 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 and more vaccines. At the national level, the American Academy of Pediatrics is going to continue what it has always done, which is to put out their recommended schedule for vaccinations for children. This is no longer being supported by ACIP and the federal government for political reasons. Here in Nevada specifically, our school entry requirements is directly tied to ACIP. So instead of being tied to evidence-based medicine, it's tied to political whim. So during the interim, I need all of you to work with me to help to let the political leaders know that this needs to be a decision by medical evidence and not just political whim, what vaccines kids need to have so that the most vulnerable in our community are not threatened with diseases we once thought eradicated, like measles. And the most important thing, right, for kids, and Krista already talked about this during the interim schedule, is to get out the vote. The number of people who don't vote, who think it doesn't matter, is way too high. And we need to convince them that it does matter. At the national level and the state level, the American Academy of Pediatrics works with a group called Vote ER. It was started by emergency room doctors, but now doctors in hospitals throughout the country are using clinic time to encourage people to vote and tell them that it absolutely does matter for kids' health. So thank you for my time, and I'll hand it back to you, Elisa.
Thank you. It's super helpful and insightful. I really appreciate it. So now we're going to go to Dr. Ashley Noel Pruitt. She is the Associate Director of Technical Assistance and Policy with Be Here, Nevada, and is a member of the Children's Mental Health Action Coalition. And she has been committed to the delivery of mental and behavioral health care to children and families for her whole career.
Thank you. Again, my name is Dr. Ashley Noel Pruitt, and I would like to share that being a part of both CAA through my graduate work at UNLV, as well as my role with Be Here Nevada, offered me a unique perspective as to how we are able to support moving legislation forward in our mental health workforce arena. The experience participating in the coalition was refreshing. It offered hope. And having been a provider for many years, I too saw the issues that this coalition saw, and the coalition was able to provide a pathway to help induce change in that behavioral health sphere. Lessons that I learned while advocating throughout this session was that forward is a pace. There isn't a speed limit on progress. There will always be kids, families, and professionals that need support with making things better. And we will always be on the cusp of the next session. So just because we didn't get the outcomes that we wanted in every single area does not mean that that's the end of it. You keep taking the helm forward, you keep the flag moving forward in order to effect change later. We keep telling our stories, and we keep everyone focused on the goal of helping our youth, our behavioral health workforce, to get what it needs in order to support us to have a better and brighter future. Your voice is also vital, so ensure that it's heard. Tell everyone you can how it can be heard, because a lot of people don't know. Throughout this session, I saw many people who had no idea how any of it worked or where they needed to go or who they could speak with in order to ensure that they were heard, that their experiences were shared. And that was an important thing. So we were able to offer that through our weekly calls with CAA, and also with Be Here through our newsletter to ensure folks knew what was going on with the legislation that we were trying to help everyone be aware of. There will also always be someone in opposition was another lesson from this session. And it's okay for someone to be in opposition. That's why it's so important for you to be there to support the legislation that is most important to you. What you don't want to happen is that there is opposition and there's no one there to support. We have some priorities for the next session. During the interim, I think continuing to move that needle forward in the mental health workforce arena is the priority. So building awareness surrounding legislation that we're able to support. AB 269 is one that comes to mind right now, which was the expansion of student loan repayment for health careers to include additional behavioral health providers, which is super important. So throughout the session, the work of Be Here will be to ensure people are aware and ready to apply on the Nevada Hills website once that's available and open for the next round. Also, connecting on a human level to identify the needs and opportunities to support in the behavioral health sphere and for the workforce. I think what that looks like is community partnerships and collaboration, listening tours to listen to what is going on, what's happening in our rural and frontier areas, what are the things that are vital to know so that we can have a united and collaborative front presented and ready for the next session. Some of the most important issues that I've saw or that I think are vital to advancing things for children and families in Nevada is first, expansion and retention of our mental health workforce. This is a multifaceted issue that requires a multifaceted approach. We know that there are needs. We know that it is a vital scenario right now. It's dire. We have to get the folks in here. And so being able to approach it from not just one single aspect, but bringing everyone together, building those coalitions to help ensure that we get it done is an important thing for right now in the interim area. Navigation for our youth, so expanding our behavioral health services so that if you have a youth and mental health crisis, they don't have to dial 911 in order to become justice involved to get the access to the support that they need. So ensuring that the other options that are available, the other opportunities are available for everyone to hear and to see and to know, to make it easier for our families to navigate the behavioral health supports that we have available to them now. And I think the most important part of all of this, the most important piece of the puzzle are people like you all here today, advocating, attending events and meetings, building coalition, and continuing to tell your own stories and bringing awareness to the needs of our community. So thank you all for being here and doing just that. You are the most important part of the plan, and please always remember your voice is vital. Back to you, Alyssa.
Thank you so much. Next, we are going to hear from Jonathan Norman, as promised, with the Legal Aid Center of Southern Nevada. He has an extensive bio, which I will not read for you, but you should check out. But he's been a dedicated advocate for foster youth in Nevada and has worked tirelessly to expand critical services and support for young people in the child welfare system. So welcome, Jonathan.
Thank you, Alyssa. It's great to be here. Session, it feels like it was a lifetime ago and also last week. So pretty interesting. I'll talk a little bit about SB 284, which Annette touched on earlier. It was a bill that we worked really closely with the Children's Advocacy Alliance in the building to get that passed. And so at a high level, what it does is it stops child welfare agencies, which in Nevada we have 3, Clark County, Washoe County, and the rurals, from intercepting and using the child's federal benefit, which could be Social Security disability, a VA benefit, or a death benefit because one of their parents passed away, for covering the cost of that child being in foster care. So there's a growing movement in our country. We were the 6th state to pass this type of legislation. There are 18 other states that have passed some version of it, but not the Model Act. And then there are 14 states with pending legislation to stop those child welfare agencies from using that money to support a core government function. And what the bill basically does is it does require the department to apply for it if there is no appropriate representative payee, to become the representative payee, and then to preserve that money for that child when they exit care or are reunified with their parent or go under a guardianship. So, and what that means at a practical level for our kids, it'll be fully implemented in January of 2026, January 1st, is about $2.5 million a year. So that's the amount of money that was being intercepted and being used by our child welfare agencies. If you take a 3-year average look back, so $2.5 million that will be preserved for those kids. So a huge win. And it was great to work with the Children's Advocacy Alliance on that bill. We represent every kid in Clark County who's in the child welfare system with our CAP attorneys. And then I also represent Northern Nevada Legal Aid that does the same in Washoe County. I'll say for reinforced lessons is have a bias for action when you're in the building. There's so few days, you get 120 days, and you have to have a bias for action. So when you're sitting there, you need to be taking action to move your agenda forward because you have such limited time. And I'll give you a good example. When SB 284, it started in the Senate with the majority leader, so we presented there. And when it got to the floor, the vote went 14-7. So we had 13 Democrats and 1 Republican. And to me, that was a red alarm because we have a Republican governor. We need more than 1 Republican. So I remember Carissa, Caleb, and I getting together and started talking about a strategy in the assembly to widen that net so that we had more Republicans in support of this policy. And we developed 1-pagers that targeted Republicans. We found think tanks nationally that, whether it was the Goldwater Institute or the Federalist Society or the America First Policy Institute, that supported our position that these benefits should be preserved. And Carissa was able to get those into a 1-pager, and then we lobbied Republicans very hard, and we ended up getting 13 of the 15 Republicans in the Assembly voting in favor of that bill. But that's because we saw something that wasn't going well, and we almost took immediate action and turned that tide in a matter of weeks. For our interim, we cover more than just child welfare. So we had 14 bills that we presented this session, and we passed all 14, made it to the governor's desk. 5 were vetoed and 9 were signed into law. So making sure that the 9 that were signed into law are implemented. The Legislative Commission meets next Monday for their first meeting after session, and they're going to be, going through regs, not any regs from this past session yet, but making sure that the bills that we cared so much about and fought for are actually implemented with fidelity. And if they're not, and if there's hangups, one of the cliches in the building is this is a cleanup bill. So getting that ready if we did misstep or there were some of those, often talked about unintended consequences. And then building out a more an economic coalition to talk about debt in our state, whether that's medical debt or just consumer debt, because we really think that's it's not a ticking time bomb because it's exploding every day for families. We see people coming in every day, and the only tool we have is bankruptcy because of high interest payday lending. We're the 2nd worst state in the country for payday lending, only behind Idaho. And when families aren't secure, when families have to take on that kind of high risk debt, it's bad for kids at every level. And then, of course, our housing agenda. And again, that goes back to the stability of the family. There were some wins in housing. We passed AB 475, which is eviction diversion appropriation to help families and adults with disabilities and seniors avoid eviction. And then AB 121, which is transparency in leases for when you're going in, that you have to know what you're paying for up front in a landlord-tenant context. But then we had bills that were vetoed. One, fixing the summary eviction process, habitability, making sure that families and kids aren't living in apartments with mold, right? And so those things are really important. And obviously evictions, when a family's evicted, that kid is not going to be in the same home. They might lose their babysitter. So those effects cascade. And so building that out, and then also, as many of you may know, the Campus for Hope is being built on the SNAMS campus. And a piece of that is the Campus for Hope board is going to rebuild, I think, 3 cottages, a total of 36 beds for our kids with serious behavioral and mental health issues, so that they're a resource in that continuum of care, and we can get kids off the Child Haven campus. So, just being there for that as that develops. They've already made that commitment, and we're very grateful for that. And then finally, other things, the most important issues are probably going to be how we navigate federal cuts and how those impact our state. And then, like I said, the economic stability of families going forward. So those are the things we'll be working on. Super happy with the way session. It was a difficult session, but we thought we got a lot of really great policies advanced. So thank you for having me, and happy to answer any questions when we get there.
Thank you, Jonathan. That's covered a lot of ground and a lot of great work. Next, we're going to hear from Chelsea Bishop and Rebecca Acosta, representing Act for Kids Nevada, which is a nonprofit organization that lifts up family voices and ensures the parents are at the table when decisions are being made on behalf of their children. So I'm going to turn it over to Chelsea and Rebecca.
Thank you for having us today. Yes, we advocate for more comprehensive health care for the kids in our state, and that includes raising up the family voice. We feel like it's been left out of the conversation in many aspects, and we're hopeful to keep infusing the family voice into more conversations around this. For this legislative session, this was our very first legislative session as an official nonprofit, so we have been learning a lot. We submitted testimony or support for 14 written bills. One of our lessons learned was just the power of learning from others. We were so grateful for the updates provided by CAA, the weekly ones from them, updates from the Governor's Council on Developmental Disabilities, Department of Health and Human Services, Las Vegas Hills, and then another one that was really impactful was the Southern Nevada Healthcare Forum. We also learned that there were lots of tricks to trying to fit in learning about the bills. One of them, for me personally, that was helpful was if I needed to listen to one of the hearings late, that I was able to go on YouTube and do it at the 2x speed. That was very helpful for me. We have our wonderful board member here, Rebecca, and I, and another board member, Tani. We were able to go up to Children's Week, and we were so grateful to be able to participate that and really shine the light on the issues that face children. Rebecca is here with us with A&J Patient Advocacy. She's one of our wonderful board members, and she really helped us tailor our legislative strategy, Act for Kids Nevada. And I'll pass the time over to Rebecca to share the rest of our message.
Thanks, Chelsea. One of the biggest lessons I think I learned, relearned, as everyone before us has said, is that showing up really matters. Voices are going to be heard in each session, each call-in, each work session. So be sure it's your voice that is being heard, your family's needs, your kids' needs. Kids and parents should definitely be involved. I think I had the most fun, if that's allowed to be said, during a legislative session. During Children's Week, because I brought my 15-year-old son with me, and he got to advocate during a hearing alongside me as an advocate, and then members from the American Academy of Pediatrics. So that was super special and very impactful for both him and the Senate bill that we were advocating for. Our interim priorities at Act for Kids, like Jonathan said, we're going to be looking really closely at those bills that were passed and how they're implemented. We want to make sure that they, one, are implemented and that they have a positive impact on children and families as they were intended. And we're super excited to continue being members of all the coalitions with the Children's Advocacy Alliance, as well as continuing those relationships with our elected representatives, new and incoming. And then we really want to regroup on anything that died in committee or was vetoed by the governor and figure out a plan going forward, because they are critically important measures. And then we just got to keep trying. It's going to happen eventually. And then overall, our priority at Act for Kids is just advancing comprehensive health care for our children. Every child, their physical, behavioral, mental health, it all is connected and it all matters. And I think something that we kind of hold in the back of our heads and hearts, I guess, at Act for Kids is that youth are 20% of the population of Nevada, but really they're 100% of our future. And so when the days are long and hard and we have some losses, we keep that in the back of our mind and hope that we can continue working with all of you in that vein. Thanks. Back to Lisa.
Thank you. Excellent work for your first official session. Nice job. Now we're going to go to Andre Wade, who is the State Director of Silver State Equality, which is Nevada's leading LGBTQ plus civil rights organization, where he brings many years of experience in public service and nonprofit work. He has been a tireless advocate for not only those issues, but the intersection of equity, inclusion, child welfare, youth homelessness, and all around well-being and safety for all of Nevada's children. So, Andre.
Hi, thank you for having me. Hello, everyone. This is Silver State Equalities. I should have counted, I think our fourth session, the first one being in 2019 when we were founded. And we had been hugely, wildly successful in getting our bills signed into law. Up until this session, we had only one bill that was vetoed, but now we have a lot more added to that list. So this session was not very successful for us as relates to our priority bills, which was three that got vetoed: gender affirming care shield law, a bill that would make book banning a lot harder, and an insurance bill, like non-discrimination insurance bill. Although three of our priority bills got vetoed, about half of the six of our supporting bills were signed into law. So there are some wins and victories in there. One thing that, or a few things that I think we learned this session, which a lot of it kind of goes without saying, but I think having this unique for us experience as far as the outcome of the session just made us realize, of course, that the political environment matters, and it doesn't necessarily matter how good your policies are. The bill could still get vetoed for reasons that are unrelated to your actual policies. But in that, just needing to implement certain strategies to ensure better communication about the policy concepts, getting folks on board maybe sooner and differently at different lifetimes of the bill throughout the process. But also that I've heard this before, and I think it makes a lot more sense now, that if a bill doesn't, if it gets vetoed or it doesn't get passed or it dies somewhere along the way, there's still some things to learn, some things to know, and you can easily pick up the bill concepts and have it ready for the next session. That's something we did this year with the Shield Law. We tried it again for a second time. And so that's always an option. And then also sometimes the politics within the legislature that has nothing to do with your organization or again the bill concept can get in the way. And these are things that we often can't control, although we try to mitigate, but we will still try to do the best that we can throughout the session. We probably the closest child-related and young people's bill that we were focused on was probably related to the book banning, just wanting to make sure that diverse library materials in the public libraries and public schools are made available. And so we will probably try to do that again. And so we don't have any plans right now during the interim, but we will soon be finding out what our policy priorities will be in the next session coming up because it's going to be here before we know it. But I think we'll need to do a better job of building some different and better types of relationships across the aisle leading into the next legislative session. We historically have had a work group that was actually born out of Children's Advocacy Alliance, an LGBTQ plus youth and out of home placements work group that back in 2017 passed, developed and worked to pass and get signed into law two bills, AB 99 and AB 180 around child welfare and juvenile justice. And so we have this work group that we've been taking on here at Silver State Equality, and it's been pretty dormant for capacity reasons, but it's something that we always need to make sure that we focus on our young people in out-of-home placements, and especially those who are LGBTQ plus, who need a certain type of care and certain types of resources. And so we just want to make sure that providers are equipped to handle these young people with care when they are in foster care or in juvenile detention or however. So that's where we are with the session and the outcome and the interim. And we do have a student advisory council that we will try to get up and running again. We paused it because recruitment after the election became a little difficult, and then we're leading into the legislative session. But the aim is for the Student Advisory Council to help us inform education policy that needs to be worked on in communities at the state level and the legislature. So hopefully we can have that work to continue to inform what we'll be doing in the future. So thank you for having me, and yeah, happy to answer any questions when the time comes.
Almost there. Thank you. And we're going to wrap up with Denise Janata, who I think probably everyone knows. She is currently serving in a role as an early childhood systems consultant with Children's Cabinet and First Five Nevada. But she also was the founding director of the Children's Advocacy Alliance. So I've known her for several years. So we're looking forward to hearing her thoughts.
Thank you. And I'm glad you didn't say a number there because I think some people were saying which session it was, and I don't recall how many sessions, but I did take a little bit of a break from participating in legislative sessions. So I think for me, the biggest lessons learned were actually reminders of what the legislative session entails and what it takes to get some bills moved forward. Right now, my focus is primarily on early childhood, particularly early childhood systems and collaboration and coordination. So everything from childcare and pre-K to maternal and child health and early intervention services. So we have really a broad array of things that we're looking at for the early childhood population. But I think that some of the reminders and lessons learned were really around, it's a short session, right? It's 120 days. Things move very quickly. And, most of the work needs to be done now during the interim. There's, identifying, being very clear on the policy priorities, having the coalitions and the groups with unified messaging and the advocacy, and really making sure you're identifying the opposition and what those specific strategies are. So when you're going into session, really prepared for that. So some reminders there. And I think one of the benefits of going last in this group is I think almost everybody's talked about a lot of the things, but definitely the politics versus policy. I think that was it's always an issue during session, but I think was very relevant this session, in addition to, the pressure regarding funding and potential funding cuts. So, what we're looking at, we're still, strategizing for priorities for the interim, but I think it really is focused on what are our priorities as an early childhood sector? Where do we need to put most of our energy into building up that strong, unified grassroots support? Really spending a lot of time identifying those key policy makers, educating them, doing advocacy, messaging around some of those key issues. I think timing is an issue with that, particularly with an election coming up, and identifying which legislators are you talking to, who's going to be their next session. So really having a good strategy for doing that. And I agree. I think it was Lee that talked about the GOTV efforts and getting out the vote. It's really important to make sure that we have elected officials who are aligned with our policy priorities, and that's a crucial key piece of it. So I think, as much as we tend to focus on the policy issue, I think really focusing on that elections and who we're putting in office to make those decisions is really key. We're close on time as part of this section, but I think moving forward, some of the most important issues for children and families from our perspective is, really looking at early childhood governance structure. So Jamal talked about SB 82 and the Early Childhood Systems Office. I think really taking a look at that, and that's been attempted in the past couple of sessions. Can we restructure that? I think we have a little bit more information now, have had some opportunities with the Gwen Center report and other documents to really be able to look at what that looks like. So I think there's an opportunity to enhance that and really work through this interim to bring on more support for a governance structure that works for families as well as with providers. But some of the other really big issues, I think one is revenue, always our biggest issue when trying to put forward programs and policies, and expanding access it's not always that people opposed to the policy, it's that there's not the funding available. So really making sure that we are looking not just at the programs, but also looking at how do we fund those and coming in with some of those solutions on the funding piece. And then programmatically specific childcare subsidy, increasing access to affordable quality childcare options, both home-based and center-based, and all of the pieces that go with that, I think is huge. We're seeing a lot of demand for that. Really taking the next steps with SB 460 on expanding access to universal pre-K. So really putting the funding in, the policy behind that. And then there was a few other, I think, key provisions around expanding access to things like home visiting programs and other programs specific to support foundational development for our early childhood population, really to prevent the need for more costly programs and services and remediation later on. But with that, I will pass it back to you, Melissa. Thank you.
Great. Thank you. Really appreciate all the work you did and have done over the years. So we wanted to save some time for questions, and you can put them in the Q&A tab. or raise your hand either way. And our first question comes from Dr. Tyler Gardner, who has also been a director of the Children's Advocacy Alliance. So we have a full leadership coalition here. And her question is, first appreciation, thank you for investment in youth and families. Asking if we've identified our priorities for the interim and also if we anticipate priorities resulting from the federal developments. So the short answer is this is the first step in identifying the priorities for the interim, and we're revisiting our process for doing that with all of you. So this is the first step, and we're happy to hear your additional thoughts as you've heard all of the information here. And we'll go through a process with all of you to really sort of flesh out the priorities. I think we're all waiting for the 1,000 shoes to drop on the federal developments. So certainly to the extent we can have clarity on what's happening at the federal level, I think we will have priority responses. I anticipate we'll actually sort of have two tiers. One is, here's what we're doing in the state where we have more knowledge and control, and then maybe rapid response to what's happening at the federal level. And I'm where my screen is set up, I don't see Dr. Rains. I don't know if you want to jump in with any additional information on that one.
No, I think you covered it. We are listening and we're working with our national partners and our funders to make sure that we can be nimble and share information that is relevant as our federal context is constantly changing. So
Great. Great question from Jay. What are some of the most important committees in the next 12 months? And I'm going to see if Carissa and or Caleb are on. The interim committees usually don't start actually meeting until January, although last go around, some of them started a little earlier. But they do get a lot of information in those interim committees in our state legislature. And we are, I'm sure, looking for opportunities to present information and data so that we can help the legislators target policy solutions to priorities. Carissa or Caleb, you have any specific thoughts?
Yeah, I can jump in so you're right. There are the behavioral health policy boards. There's also a few consortia for children's mental health. So I think it really is going to depend on the policy issue. So this is something that we do talk about in our coalitions, like when we were working through our Children's Mental Health Action Coalition through the 2024 session. We were always aware of like when the various boards and commission and consortia were meeting. And then that was really helpful. And we actually had people from those groups join us in our meetings. And so that we were all trying to be on the same page. So I think that we'll follow something similar for the next interim. And then I will also add, we really leveraged the interim committees in 2024 to start talking about our policy priorities and to identify champions for our legislation. So, and for us in particular, that was the Health and Human Services Committee, the Joint Interim Education Committee. That's really where we thought we'd be the most. And it was funny when we actually went into our 2025 session, our bills were being scheduled in the Commerce and Labor Committee, in the Government Affairs Committee. So not quite what we were expecting, but so and in alignment with that, it'll really be dependent on the agendas. So paying attention to the agendas of the interim committees and whether or not what they're talking about is related to children and families. And then Jay, you also have a resource that we were talking about a little while ago that if you can add it to the question and answer, that resource and maybe a little description so that everyone can read it. We won't answer it live so that everyone can still refer to it and see, but Jay has a cool data resource that would be really helpful for following these different committees.
Yeah, it's really helpful to see all those committees and meetings in one place because you can spend quite a bit of time down the rabbit hole of the internet uh, of trying to track down when these meetings are, even though they're public meetings. Dr. Rains, you had some additional thoughts.
I was just going to add, Jay, all of them are the most important committee because like Carissa said, we don't know where our priorities will land. And so I think it's important to watch and to get to know the members as well as we can during this period and make sure that they are clear on what our priorities are. And so our coalitions are taking a little break for the summer, and in August we will pick back up and start having coalition meetings again and can chat more about what those priorities are and how we can work together toward a collective vision.
I'm going to leave Jay's questions there so you can see the website that basically consolidates all the relevant public meetings in one place. Other questions? Comments? Thoughts? And if we don't have more questions, we can go to Dr. Rains with a little sneak peek of what the data says.
Thanks, Elisa, and thanks, Carissa. So it is the Kids Count time of year again, and Nevada for the second year in a row, excuse me. Okay, kind of sneeze there. For the second year in a row, Nevada has ranked 47 out of 51, and we do not want to be here. However, I think there's a couple things to keep in mind. We are doing good work. We are making progress. This is a relative score. And so what that means is states that have incredible infrastructure for children and families, like Connecticut or Rhode Island, when they continue to make progress, when they continue to do good work, we just don't see the movement in our score. It is important to note, though, that this year, in looking at the 16 indicators that the Casey Foundation uses to put together these rankings, we did worse in a lot of them. And this is alarming largely because this data runs about 2 years behind real life. So this means in 2023, we were seeing more kids than we had previously who were more child and teen deaths. We were seeing more low birth weight babies. We were seeing fewer 8th graders who were proficient in math and fewer 4th graders who were proficient in reading. We were seeing fewer children ages 3 and 4 who were not in school. We're seeing more children who have parents without secure employment. So that's more kids who have parents who are doing things like gig work or contract work. We're seeing more children living in households that have a high cost of housing burden, and that's where more than 30% of the households goes toward rent or overhead. And so there is work to be done. And we want to talk more about what we have going on in regards to the data for children and families through our Nevada Child and Family Fact Book. So what is that? I'm so excited for it, y'all. You have no idea. So under Denise's brilliant leadership, the report card came out every year, and it gave an assessment and a ranking of how Nevada was doing on these child well-being indicators. That evolved over time, and more recently we had the Nevada Quick Facts book, which gave a little bit more information about different areas. This year, we're moving it even farther, and we're creating our Nevada Child and Family Fact Book, which will be a reference guide, and we'll have data on a number of indicators and show how Nevada is doing across the board so that you could reference it, right? So we can look and we can say, hey, how many low birth weight babies did we have in Clark County versus Washoe County? And you can look in this beautiful reference guide that we're creating, and you can have that information. And so we're really excited about this as a tool to be used both in the interim and in the upcoming legislative session. And hoping to build on this year after year to eventually get to, I always have to say it, Rhode Island is my aspirational fact book reference book. Check it out, see what they do. It's really incredible. And I think we have the spirit and the drive and the know-how to create a really thoughtful, intentional reference guide that we can have here in Nevada so that we're making decisions that we know and are strategic and know will impact and improve the well-being of our children and families. And I'll give it back to Elisa.
Great. All right, so we're wrapping up. What's coming up next is the breakfast that we're doing August 14th. This is in Reno. This is a combination of the Human Services Network Awards breakfast of previous years and sort of the formal presentation of the Kids Count data book. So a lot of going on. We are looking for sponsors and also folks to attend. So this is really the next step in the process of working with our partners, discussing and having a evidence-based grounding to our priorities and our policy work. Just a chance for folks to get together and grow our presence in the North. There's the link for tickets, or you can use the QR code. So we would love to see everyone. There also will be the Policy Summit later on in the year. So if you don't have the chance to make it up to Reno, we totally understand, but would love to loop in and see our Reno friends. So that is the next project that we are working on. If there's any other questions or comments, I guess the Q&A tab or button is working for folks. Carissa and Dr. Rains, any other closing thoughts?
I would just say that we're really excited that you were able to come join us today. And we're really excited to keep building with all of you. I think that what we really took away from this session was the power of community voice. And when we come together, we can really have a strong impact. So we're going to look forward to how we can continue using our collective voice as a strategy and make sure that we're able to push priorities as a team. And that includes refocusing on things like our policy, on our data. So come to our data breakfast. I'm up in Reno and I would like you all to come see me in Reno, please. And if you're already here, I'm so excited that you're going to already be coming. This QR code also works, or it's all over our website. It's in all of our email signatures. So please come join us.
And I think, like Elisa said, we're looking for sponsors. We're also looking for sponsors for this Factbook resource guide. And so if you, your organization, or someone you know are interested in sponsoring a specific indicator or interested in leaving your legacy as a part of this book, that is an opportunity as well.
Yes, and I don't think I mentioned, but there is a block of rooms at the hotel. So there's also information there. If you're coming from Vegas, we have a room block that you can tap into. So it's at the Whitney Peak Hotel, which is a great location. So again, since this is sort of my first official event with the Children's Advocacy Alliance, I really appreciate all of the great work that the staff and our partners did. I think we learned a lot together as the panelists shared. I really appreciated the insights and the dedication. And I know we're just going to keep getting better with all the work we do together. So looking forward to seeing all of you in person, one end of the state or the other. And thank you so much for joining us today. And here's how you can get in touch with us and keep track or learn more or continue the conversation.
Thank you, everyone. We'll hold the room open for a few more minutes for anyone if you have last minute questions or if you just want to hang out with us.